Okay, good evening, everybody. Thank you for coming. Um, I'll start tonight with a presentation similar to webinars we've done in the past, and then I'll ask our medical team, who some are here now and others will be joining, to jump on once we're done to help with our Q&A and get some of your questions answered. But before we begin, I want to say welcome. Thank you for your time. Thank you for participating. We're into week 4. And certainly since no one's opened in a school in a pandemic before, and we were certainly one of the early boarding schools, if not the earliest boarding school to open, we are learning along the way, learning lessons, as I'll talk a little bit about, from those schools around the world and summer programs that were open before us. We have been able to maintain a healthy community up until this point, and I thank all of our members of our community for their efforts on that. It is a group effort and certainly difficult, and talk about some of that as well tonight. And we're hoping to continue that strong result through the end of the semester. And also tonight I'll talk about hopefully some loosening of some restrictions, and that's been chatted about among our medical team as well. So I thought it would be great to have them here to do some Q&A after the presentation. So similar to the presentations that I've done before, we did have and continue to have our Bring the Penguins Home task force, and now we're on the still doing a lot of work on our weekly meetings, addressing issues that come up and talking about adjusting our dial and our dimmer switch, which I'll talk a little bit about as we go on tonight as well. And as I've done before, it's just an update on today's stats, and I've done that at our few meetings in the past. I did a webinar every other week in the summer, accompanied by letters, and wanted to continue that communication. You received a communication from us the first 3 weeks of school, and now in the 4th week, you have this webinar tonight, and I'll talk a little bit about the communication schedules going forward. But newly reported cases in Massachusetts today, 419, which is up, and you'll see there is a slow uptick trend right now of cases. Still very good numbers, but something we're definitely keeping an eye on, and certainly can ask our medical team about that as we're at the end of the presentation in the Q&A. You can see another slide, and this is all available on mass.gov in the COVID dashboard, looking at positive rates of patients in hospitals, hospitals using surge capacity, and deaths. The thing to remember about this, and our MDs will talk about, is it's a snapshot in time, and certainly even though, say, so on September 17th, we have a number, as we move forward, cases attributed to this date will move, right? So the number today, 3 days from now, may change on the 17th. So just something to remember, that the reporting isn't necessarily written in stone in real time, but is fluid and elastic and does change, and we can talk about that if you'd like. And then daily and cumulative confirmed cases, and you can see, if you're looking at my cursor there, you can see that slow rise, and also we can talk about, is that predicted to continue, why or why not, things like that. So that is a sort of pandemic update, at least from the local level, or for what we're seeing in the state of Massachusetts. And continuing with our task force, we do still have our operations expert from AUX helping us, Dr. Adriana Bravo, who may join us later tonight. She had a webinar at her own school, but will hope to join us for the Q&A section later on. But they are still involved in our task force and health and wellness, working with our own health center as well. Dr. Christina Ermos also may be joining us later from UMass Medical on our task force. Dr. Ann Hohen, who's on the Dartmouth task force and associate professor of epidemiology at Dartmouth, and she's on with us tonight, and we'll be here to answer some questions as well. And then our own medical team, Dr. Michael Muchler, who will be on tonight answering questions, Elise Lewis, our Director of Health Services and nurse practitioner. So they will both be here, but also I wanted to include Molly Snell, if you haven't got a chance to meet her, additional nurse practitioner, and then Amy Lister, adolescent psychiatrist, and John Price, Director of Counseling. And we do have Jennifer Bernard, who will be here, and I'll let them all introduce themselves at the end, but they will all be available as well to chat and answer questions. Just an overview, and I won't spend too much time on this because I talked about it a few times in the summer, is that we still had planning committees looking at the student experience and what that would look like and how we would still have viral mitigation in all of these areas on campus, whether it's academics, athletics, student affairs, but still try to provide the best student experience possible while maintaining the highest level of health possible. Campus operations and business continuity, looking at all what that means in terms of our operation and our revenue and expense, facilities, food service, IT, transportation, and everything that goes with that. Health and wellness, rebuilding our health and wellness team. We're excited about the team that I just talked about, as well as our consultants who are helping us as well on a health and wellness level. And then we've really tried to get out in front with communications, with my regular office hours in the summer, with our webinars every other week, with the various letters that we sent home and plans. We now have revised or updated our Bring the Penguins Home web page, which I sent out a couple of weeks ago, is now an update and a Keep the Penguins Home update page. So you can see that on our website. If you go to Cushing.org, it's a banner right at the top, easy to navigate and get to. We have some resources there, as well as updated information. Archive of letters is found there that I've sent. These webinars are there. And it's just another place to get some questions answered. There's a Q&A as well. So another resource to look at information regarding our operation in this pandemic for the fall semester. As you know, repopulation went very well. Something we had never done before, but arrival process, to credit to Catherine Pollock and our student experience team was smooth, and our residential life team, of course, onboarding everyone in the dorm. And thank you to everyone for your cooperation and for remaining outdoors and for helping move students in. I think that was as smooth a process as possible for going through and getting your sign on your windshield and getting tested and then moving from there. So we're excited about that. And then the first 4 weeks, certainly a new time. None of us had experienced before, that social distance, that mask wearing, the need to, modify activities and behaviors. And we've done, in addition to that pre-test and an arrival test, also did a post-arrival test, and then have tested 20% of our population on a surveillance test every Wednesday, including yesterday, which has all been negative. And I don't have yesterday's result yet, but hoping that trend continues as well. So certainly the start that we had all hoped for in terms of the health of our community and keeping it free from COVID. Some of the things that we've changed. So, and I talked about this, during the summer, but I think it's important to review and chat about. So we are requiring masks at all times. Said that on arrival to students. And that really that's one of our big defenses against viral transmission. Physical distancing being the other. Creating the waddles and limiting interactions within waddles as much as possible, which ultimately limits your close contacts. So when we do have to do contact tracing, it is limited to those individual groups. When our health services team and also our physicians look at, okay, who do we need to quarantine, who needs to be tested, who needs to be separated from the community for a period of time. All of those strategies of mask wearing, physical distancing, and limiting those interactions and close contacts hopefully limits the number of people that will have to be involved in that contact tracing event. And so, home visits are suspended, and I know that's tough, and I'll talk a little bit about that as we go on, but certainly, that would expand our close contacts and open up a variety of scenarios that we just right now can't take on as a congregate living environment where we're all living in community together. And although we're limiting those close contacts, we all are occupying the same space and want to keep it as protected as possible. Dining hall practices, certainly within Waddle. I mean, that's a time obviously when masks are off. So we do grab and go or use outside spaces whenever possible. And then sports, trying to create, we had a sports subgroup in our student experience committee where we, at least to begin with, looking at maintaining 6 feet apart, and no scrimmages to start with, having activities that are conditioning or drills, things like that. So another strategy there as well, but different, a change for the school year. And then no trips to town, looking at students going into town. And although Ashburnham is pretty free from COVID in the last few weeks, hadn't had any cases. Last week had 4 cases pop up, and we don't, in review and conversation with our medical team, and looking at the dimmer switch, certainly moving to the next color does include town trips, but we're just not ready to move there yet as we start to move the switch. But that was how we started the school year, and something that we will maintain. And that it's just a lot of variables going into town, and we're not ready to get to quite to that level yet. We've continued, and I said this early on, the first webinar, the first time we gathered the Penguin Task Force was May 6th, and the first webinar we did was May 21st, a couple meetings in. And one of the pieces of information that I had gathered, along with talking with our task force, was talking to schools that had started to go back to school, even as early as the spring. The Australian Boarding School Association spent a few conversations with that individual, and they went so far as even assigning bathroom stalls in dorms to only certain students, and only certain students could use a specific shower. And things that we ended up not doing, but also a number of strategies that we did. And talking to TABS, the Association of Boarding Schools, and some of the seminars they did, and I know Dr. Bravo was involved in some of those, and then international schools and lessons learned from successes, things that worked, things that didn't. And then, of course, the American Camp Association, who was needing to bring people together in congregate living spaces much earlier than we were. And I think something like 80% of residential camps didn't happen this summer, but some did, and some were successful and some were not, and some didn't make it through the summer because of the pandemic, and others did. And what lessons could we learn from that? I was actually on a call with the director of the American Camp Association at the end of the summer, talking about lesson learned and what they had seen in terms of the programs that had been successful, and what the traits of those programs were, and what were the common practices, and trying to utilize those in our own community as we're working with our task force and our medical team to be successful this semester and be able to provide an in-learning experience. When we started, we said our guidelines are health and safety has to be a #1 priority. And if that priority is met and we can open for face-to-face learning, then that's what we want to do. The American Academy of Pediatrics is recommending face-to-face learning for students. And if we can provide a a healthy and safe boarding community, then we can, be able to open. And then we need to be able to provide an environment where we can stay open, knowing that, we are together. So kind of the stakes are a little bit higher. And how do we be able to move through the fall semester and do that? Talking with our experts, looking at past programs that have been successful, other boarding schools that have been successful, schools around the world that opened months ago, and how they, succeeded and failed in some areas, and hopefully, building on those successes and avoiding those mistakes. So another data point for us, and valuable conversation as we spoke with these various schools, organizations, and summer camp programs. I think going on to lesson learned, both of these articles are from the CDC, and I contemplated whether to put them in here or not tonight, because they are a little bit lengthy, but they're from papers looking at 2 different scenarios. One was a summer program in Maine, actually 4 summer programs in Maine, where there were 4 summer programs totaling about 1,000 students that were able to remain healthy and open, and I believe almost COVID-free, a few cases here and there between the 4 summer programs. And then the second one was a camp in Georgia where half of the attendees and staff, I believe, were infected with COVID, and some of the research that was done there. So I thought it was worth putting the quotes in here. Diligent use of multiple NPIs, which are non-pharmaceutical interventions, which could be a mask, it could be all of the practices that we're doing, was successful in preventing and mitigating SARS-CoV-2 transmission in 4 Maine overnight camps. Although no single intervention can prevent the transmission, a multi-layered use of these NPIs allow camps to prevent transmission and quickly identify campers or staff members with the infection to successfully mitigate spread. And they didn't rely on a single test as the sole strategy, but stable, small, segregated cohorts allowed campers to isolate and quarantine a wide range of younger attendees with potential COVID-19 symptoms while continuing camp operations in their cohorts. And that was, a practice that we see at the college level, at the high school level, certainly at the boarding school level, whether it's boarding or day schools, or what we call waddles, other people call cohorts, some schools call them squads, really whatever your culture and community works for, but it's those small groups, and it kind of goes back to what I was talking about in the last slide of limiting limiting those contacts, limiting the number of contact traces you have, because that just exponentially grows in the event that something does happen. You know, one contact leads to 4, leads to 8, you know, and it just continues to get bigger. So that was important. And then the second one, physical distancing and consistent and correct use of cloth masks should be emphasized as important strategies for mitigating transmission in congregate settings, which we are. I thought that was important, and you know, might seem like common sense in the one point, but at the other, you know, we have had requests even a couple weeks in, do, you know, students have to wear masks, from parents and students have to wear masks? Can they take them off at practice? Can they take them off, you know, for this or for that? And we're really trying to hold the line, or we have to hold the line on that one, to say like that is one of our most important strategies, especially in this congregate setting. It's different, you know, going home to an individual family, a small number of contacts. Here, you know, with over 200 with employees, you know, over 300 people on campus, you know, we're really looking at a large number of individuals with a varying levels of risk. Let's see. And these are just headlines from the Washington Post, kind of, you may have seen them. So, you know, the quotes that I just put up were from the CDC website, so you may not have seen that, but certainly you may have seen the stories that, you know, get published about them, about the main sleepaway camps that are preventing spread among 1,000 people, and then the coronavirus infected scores of children at the Georgia sleepaway camp. So kind of shows the end result of those two research papers that were done after the fact, where these stories were done in real time. And, you know, I know it's difficult, easier said than done, and everybody's making compromises, and I think that's one thing to remember in this is, you know, boarding students certainly don't have home visits. You know, they can't go to town. They're living within Waddles. On-campus activity is restricted, and I'm sure, you know, ask any student or parent, and they can add to this list of a boarding student. You know, day students as well. We're asking them to limit close contacts, asking them to limit campus interaction. So what they do here on campus has been limited. They can't go into a dormitory. They can only eat with each other. They can only be in certain places. They're, you know, can't hold jobs on weekends. So, you know, there are compromises being made in every group, you know, compromises to be able to be in a in-person congregate living experience where, as I said, the stakes are higher because of, you know, our vulnerability if an infection does indeed come to campus. And we have a lot of strategies to mitigate that, but at the same time, prevention is our best one. And then faculty and staff as well. You know, one thing to remember, certainly, and I know, you know, for students it's difficult, of course, to think about what faculty and staff are compromising on as well. You know, they are limiting close contacts. We're, you know, asking faculty to register visitors when they come to campus, and you know, people are asking about, you know, going to take a trip on a weekend, and we're really asking faculty to give up and compromise on that as well. We're limiting dining hall access to a large number of faculty. You know, there are increased job responsibilities. You know, ask any faculty member how long it takes to prep and teach, and you know, everything just takes longer, and additional duties. And there's risk to health and livelihood. You know, that's the group where you probably would find, you know, increase. Certainly, you know, it's a group that is older than our students, and so there's risk there. But also, you know, I'm sure, among our faculty and staff that are not even known by, you know, by anyone. You know, whether it's a pre-existing condition or something that makes an individual more vulnerable, that's here because they're committed to providing that in-person learning experience on campus. So just important to remember, and especially during a time of a pandemic, I get it, it's hard to step outside, especially as an adolescent, your own experience. And I think that's why, as parents, adults, teachers, you know, we're in this too, and have good days and bad days, and sometimes we do a better job of it than others. But you know, communication with us as a school, and really reinforcing to your child when they're saying, well, you know, so-and-so gets to go home every day because they're a day student. You know, it's not always apples to apples, and that everybody is compromising to have this experience here on campus. And these were things that were talked about among our medical team, and with a very small number of day students, asking them to live by certain expectations that we felt was acceptable. Change the and also, I think it's important too, like the academy as an institution. You know, I talked about faculty and staff is also making compromises. You know, we did have a loss of a summer program. We did decrease a number of total students this year. You know, last year we were about 390 students. This year we're totals just around under 360. decrease in revenue to online learning. About 130 of our students are online, and that's a different, when they declared that earlier, set of expenses. And then, we spent about $1.2 million in COVID-related expenses to safely open for the school year. Look at, and things, you may not even see, but I know our director of facilities, Ed Kirk, even spoke about it today to our faculty in faculty conferences in an email, talking about air exchange, air filtration, different ways that we've spent to, allow for more outside air to come in, and for the older buildings to have, air purifiers and ones that, our medical team recommended, and looking at, the screening app that we do every day, and, the expertise that we brought in, and the changes to our health center, and the list continues to go on and on. The dining, grab and go, the different ways that we're able to provide cleaning and sanitation, and so, there are gives and takes on every front. And I could even add to this. And while all of that happened, a student probably doesn't feel that. And that was really my goal, is when you have all of these pieces and you do have a down year, we still want our students to come and not feel like their experience is less because the school had to take on this commitment for COVID-19 related expenses, or did lose because of a summer program, or does have a few less students in total, or does have a significant amount attending online learning. And what does that mean? And we know that faculty are doing their best every single day to make that experience as good as possible. And it is harder work. It is more. It is giving up a lot of different things to try. So I think that's just important to remember as we progress through that, and have conversations with kids as we talk about, some of the inconveniences of being on campus. And I think, one of the things to talk about in boarding schools a lot is that fare is unequal. And it was when I was talking about, looking at the experience of a day versus a boarder versus a faculty, and, I saw a faculty member got to do X, Y, and Z. And, there's definitely first, if you look at that one, always a different set of rules and expectations for adults and kids. I think, that's a norm for boarding school. And at the same time, with day and boarding, we also don't want to call out this population of day students and make them feel unwelcome. If they are abiding by our rules and being here and being part of the community, that, their experience, while fair, may not be equal. And I think, when you look at a number of things in boarding schools, in congregate living, the way that we interact, the way that boundaries are set, sometimes they're not exactly equal, but they are fair for the entire community to sustain and move forward. One of the other things that is true in boarding school, and is even more true during this time, that a mentor of mine always said was, we're at each other's mercy. We're in a small community, we're interacting on a daily basis, and how we interact is felt, even deeper. That smile or not, or, the positives and the negatives, and especially during COVID, that's intensified. But I think it's an important conversation, and not an easy one, and to have, certainly, at a time when there's expectations increase for everyone, there's adjustments to behavior being made for everyone. And we're asking kids, and adults and our entire community, to adjust to an ever-changing situation where the new normal is indefinite uncertainty. Right? I mean, think about that. It's asking students, adults, faculty to adjust to an ever-changing situation where the new normal is uncertainty. It's difficult. And I think admitting that up front is okay. And we're going to struggle like any other congregate community does. And hopefully we grow and are able to come out a little stronger and together on the other side of it. But fare isn't always equal, especially in a boarding community. Now, we are entering week 5. So as I said at the beginning, closing out week 4 of our academic classes, if you can believe that, which are those 2 transmission cycles, which will end on Monday, that we can talk about after. And that was really the time that we're looking at on starting to adjust, starting to move that dimmer switch, to allow for some, loosening of restrictions, and hopefully some increased privileges. And while those won't be, going home for the weekend or anything like that, and increasing our close contacts quickly, we do want to first start with our internal community by loosening some things here, see how that goes, and then, look at what else we can do going forward. as you know from our presentation in the summer, we've used the visual of a dimmer switch and tried to even, put some colors on each one to say we're going to start in orange and then we'll move to yellow. We're going to start to move to yellow. We're not going to get all the way there, but we are going to start that dimmer switch going. Whereas usually we're just open or not, right? We're open and everything's happening, sports, full, residential life, activities, all of that. And what we've said in our webinars previously is, we need to dial that dimmer switch a little bit, and it'll might be halfway in between, but we do want to start it going in a way that, isn't too far where we can't bring it back, but in a way where we can start to reasonably change some behaviors on campus and hopefully make it a better experience for everybody. Just as another review point, our task force did look at a number of areas and have restrictions and different, I shouldn't say restrictions, but changes to practices in many areas. Whether it's food service, the way we screen, health hygiene, cleaning and infection, policies, procedures, all of these different areas were looked at as in addition to the student experience as well. So some of this is behind the scenes, but still continuing to be a focus for us. And also, as I said, we are still living within and exceeding federal, state, and local guidelines. Our goal right from the beginning in the first webinar, I put up this slide and said we are going to meet and exceed federal, state, and local guidelines. We know we're in a congregate living environment. The stakes are higher. So we do want to keep those in mind and as a guide, but if we can exceed them, we absolutely want to do so. And we do still are employing those mitigation strategies. As I said, we're continuing our testing, 20% of our population once a week. We do still have our screening with our Aux app for students twice a day, and really appreciate everybody complying with that. And then of course have contact tracing plans in place should we need to employ them if we get a positive or suspected positive. I want to talk a little bit about some small changes we're going to make to student life as we go into our 5th week. So these are going to take effect Monday, and that'll be 2 transmission cycles, which our medical team has talked about, one cycle being 2 weeks. So 2 transmission cycles into the academic year. So 4 weeks from the day that we started in-person classes, where everybody was finished that quarantine on arrival, came out and started living with the in-person experience here on campus. So, one of the, and these are 4 of the major ones, students, we're going to allow students to visit one another in rooms. We're going to start within Waddles with the door open, wearing masks, social distancing, see how that goes. Right now, students are certainly allowed to hang out outdoors, but once they're in their room, that becomes, it's a single room, becomes a place that they can take a mask break with the door closed. And so we're still going to allow that. But at the same time, we know students want to be social. We know that's part of the experience, part of the fun. So we will allow them to visit in, one person to another room, again, with the door open, wearing masks, social distancing. Common rooms, we started with those not being open, and we're going to open those for scheduled use, again, within Waddle in each dorm, wearing masks, being, somewhat apart, using that physical distancing as well strategy. Again, see how that goes. Food delivery. So we've had those just on weekends at designated times. We're going to open that up a little bit. Student affairs will get out a process for that, and go to a central location for pickup. So that I think has been something students have been talking about, and something that we can do. Contactless, pretty low risk, a central location on campus, and we'll work through a process of that. And then internal athletic scrimmages. So our director of athletics been talking with coaches and meeting guidelines for starting that on Monday as well, to change our practices, so you're not doing so many drills, things like that, maybe having scrimmage on a Saturday. So we're looking at ways to loosen in the athletic realm as well. And then one thing I didn't put here, but we're going to allow advisors to take their advising groups outside. I'll take students at my house in the backyard, maybe, get some food, things like that, just for a change of pace, check in. Of course, that would still be with distancing, but, another way to be in contact, socialize, check in with students and have conversation about how it's going, and the usual, items that we talk about in the advisor-advisee relationship. And that's all, pending, of course, a negative test yesterday. Hopefully we have that. I anticipate that, but and to start on Monday. So I know that, we have a weekend coming up, and that's a time for, activity, but do want to get to that two cycles of transmission, start this on Monday into week 5, and hopefully, that allows for a little more socialization, a little more fun, and gets us through the next few weeks, and we can look at, moving again. Our timeline, so I've done this at the end of our webinars just so you know what to expect. So we've been communicating weekly and bi-weekly since, well, probably since January about COVID-19, looking at letters coming early on, just about, impact around the world and to our students, which ramped up February, March, and then there were lots of communications. We started webinars every other week in May, leading up to the school year. You've seen something from me once a week at the start of the school year, and now, as I said, into week 4, having this webinar. Really now want to let it go till about a month or so, until October 22nd, unless, of course, knock on wood, we don't have a positive case. But if we did, then of course we would let you know that, and the process for that going forward. But next official communication, at least as of this time, would be October 22nd, and then end of the fall semester, November 20th, and winter and beginning on the 30th. So just important dates as we're looking forward to the middle and end of the fall semester. I put this quote from Ted Mitchell up in the first one, and have kept it out, that and it's proving to be so true, is that opening is not going to be an event, and it's going to be a process. And I think as we get to the 4-week on Monday, that 4 weeks since class, we're really looking at this being the end of the beginning, and that students are here. We've had success. We're getting going, and that we're ready to move into the middle and loosen up some restrictions, and hopefully the end of the semester will be here before you know it, like it does in most years. So I want to ask our members of our medical committee to join us. I just saw Dr. Bravo jumped on, Dr. Muchler, Dr. Ermos, Dr. Hohen, and I think Elise is here as well, who's our Director of Medical Services, and then Jen Bernard. So I'll just turn it over, maybe just do a brief introduction, and then allow some time for Q&A. Dr. Bravo, you're next to me on the window, so do you want to start?
Hi, how are you all? I'm Dr. Adriana Bravo, and I'm seeing here that my name is written as Colleen's name, so I'll have to go up and change that. But I'm Dr. Adriana Bravo, and it's really nice to meet everybody.
Dr. Muchler, you want to jump in?
Yes, hi. So, hi everybody. I'm Dr. Michael Muchler. I'm the school physician at Cushing and have been there for the last 24 years. Perhaps some of you watching I have met. In fact, I know I have. But I also have a private practice along with my wife in Gardner, and I'm a family physician, but also board in adolescent medicine. I'm the team physician, and perhaps you've seen me at hockey rinks or on the football field. But it's been an interesting experience being part of the task force and trying to figure out how to keep Cushing well and safe, and certainly guiding through something that we've never ever had to do, which is go through this with a pandemic. So it's been great working with other members of the task force, and I'm going to say it's been also wonderful to see the teamwork that's taking place at Cushing, and it has to be a team. We all have to be part of this, and I know that a lot of people have questions of when can we do this, and when will this happen, and I'd love to be able to be part of the group that says here's when, but it's going to be a process. And as we work through the process each week, we know that things with coronavirus can change, and so we would all love to have this go away as soon as possible. We know it's going to be a journey, so happy to be a part of this. And so I'll pass it on to whoever next wants to introduce themselves.
All right, Jen, do you want to take it?
Hi, my name is Jen Bernard. First and foremost, I'm an alum of Cushing. I've been back here working for 25 years. This is my 25th, long time, it feels like. I work in the counseling office as one of the mental health counselors. What I want you to know is that we are open 24/7. There's 2 of us. John Price is the director. So we're here for you and here for your children. And my third hat here is that I have 2 teenage boys. I have a 10th grader and a senior boy. And have been reading through all the chats, and I will let you know that my kids are day students. And so I can speak to that. And I can also, probably later on, help you with some parent strategies and skills to sort of help support not only your children, but yourself. This is very frustrating and hard for everybody. So I know that.
Dr. Ramos?
Hi, my name is Christina Hermos. I am an infectious disease pediatric doctor at UMass down in Worcester, which is about 20 miles south of Ashburnham for those who aren't local. And I was pleased to get this opportunity to consult with the Cushing School. I've been paying particular attention to school health and COVID as the mother of 3 elementary school students. They're in public school, but I feel like I've kept my finger on the pulse of the data there, and also what's going on in Massachusetts. And I've learned a lot from the other consultants in this group as well about boarding school health in particular. I'll just mention that, looking at the weekly numbers, which just came out, things had been going well for a while, but there is some concerning trends in Massachusetts with more towns turning red. So it just, that being aware that dimmer switch goes in 2 directions always. And then the other thing I'll say, just because I might not have a chance to say it, is I'll have to go in about 10 minutes. So if there are particular questions for me, if we could answer them on the earlier side, that would be great. Thank you.
Thank you. Annie?
Hi, I'm Annie Hohen. I'm an associate professor of epidemiology at Dartmouth College at the Geisel School of Medicine, and I have a PhD in infectious disease epidemiology from Yale School of Public Health, and I did postdoctoral training at Boston Children's Hospital and Harvard Medical School in, among other things, pediatric respiratory virus epidemiology. So we've been following this very closely in my group, and I'm also, as Dr. Burton mentioned, serving on the Dartmouth College COVID-19 task force as well. So it's been a real pleasure to support Cushing, and I'm happy to be here to talk with you tonight.
Great, thank you. And Elise?
Yes, thank you. Sorry, my video is having a little bit of technical difficulty.
Okay.
My name is Elise Lewis. I'm the nurse practitioner, or one of the 2, with Molly Snell, and the Director of Health Services. I've had the pleasure of meeting a lot of your children this semester, and I'm looking forward to continue to work with them, as well as with Dr. Muchler and Dr. Burden and the rest of the medical team, in keeping everyone healthy and safe as possible.
Great. Thank you. So I'll turn it over. There's a few questions in the chat. Let's see. Answer a few. Let me just get to pop that up. Okay, please speak to why the weekly COVID tests are not risk-based. Perhaps the day students and faculty seems like they are the only individuals in the school that have any ability to leave campus and therefore contract COVID. I understand it could spread, but if there is a set population that are bringing it in, then they would be the ones testing positive if you were testing a smaller population, but 100% each week. Could you expand on that? Who wants to take that one?
I could take that one.
Go ahead.
We thought, we gave a lot of consideration to designing the testing strategy, and we actually did kind of bin the population into 2 groups. One is the individuals that are boarding on campus and stay on campus, and then another group that does leave campus every day, day students and the staff that are not living on campus. So we did consider them as 2 different groups with 2 different, kind of sets of risk factors in terms of transmission. And my recommendation was to test the group that leave campus daily at about twice the rate of the boarding students. So I think that's what's happening. So the policy is 20% of the population, but it's really broken down into slightly uneven rates. And the reason why we didn't want to recommend testing only individuals leaving campus and not do some testing in boarding groups is that, as Dr. Burton discussed a lot on his presentation, the boarding community has its own special sort of set of risk factors in that it's living in a people are living in a congregate setting. So you're kind of one large household. The Waddles help to divide it a little bit and keep contact rates lower. But household transmission is an important way that this virus spreads. And so when we think about people living together, it's really important that we keep tabs on that group as well. So so they are considered different risk factors, but it was important to test both groups.
Great, thank you, thank you. Next question, why can't we visit campus soon or maybe have dinner at area restaurants? So a couple different risk factors there. Anyone, I don't know, want to take that? Tina, I know you have to jump off. I don't know if you want to chime in on this one or?
Well, unfortunately, restaurants are looking like they're one of the highest risk places for contracting, just in terms of eating and speaking loudly and sort of a louder setting. So I think restaurants themselves are a higher risk. Obviously, being outside helps. So that's only going to last for a short while until it gets too cold. So in terms of things on the dimmer switch, that one seems more on the extremer end.
And, I know we've talked about visiting and certainly not ready to do that at this time. But Dr. Bravo, with your boarding school experience, what do you see visiting campuses and sort of pluses and minuses there?
Yeah, hi everybody, and I'm sorry, earlier when I introduced myself, I was sort of having glitchiness, so I apologize that I just sort of said my name and didn't give any context, but it is nice to be with you all. And to just round out the introduction, I'm a board certified pediatrician that has devoted my career to just independent school health, and I've been a physician in boarding schools for now 20 years and have been doing some consulting work to help support Cushing Academy over the last several months as they've been ready to reopen, and now that all of your students are back on campus and continuing to support them as a consultant. So I'm glad to be doing that. And so directly to your question, Dr. Burton, I think what we think about, in the bigger picture is, when we're talking about, well, why can't the kids do this or do that? Why can't they go off campus, or why can't the parents come and that sort of thing? One of the things that I always remind people to think about is this, that to be able to reopen school and to repopulate the campus the way you all did a few weeks ago, obviously that took a tremendous amount of effort and work and thinking and planning in order to be able to see how we can mitigate risk as much as possible. And to get to that reopening day was a slightly Herculean effort for Cushing, as it is for many other residential schools. But sustaining that reopening is now the challenge before us. And quite frankly, sustaining that reopening has the makings of being harder than planning for the actual reopening of school. Sustaining that reopening day after day, week after week is really challenging. And it's a challenge that we have to rise to, because if we were to have sort of a couple of cases or a mini outbreak or something happen on campus where we would have to prematurely reclose the campus, which we're doing everything we can to avoid, right? If we have to do that, it's most likely that reclosure of campus would, number one, be really different than it looked last spring, right? It would be much more challenging, but it also would not be something where let's close for a couple of days and clean things and reset. It's most likely, if we were to get to a point at Cushing of having to reclose, that would be for a sustained period of time. And then reopening after a closure like that is extraordinarily challenging, very, very challenging. So if we think about it in that way, that we want to kind of sustain our reopening and not, bump up against mini outbreaks or issues on our campus, the best thing that we can do is be really conservative in our risk mitigation practices and be conservative about when and how much we sort of move that dimmer switch. So for things like parent visits, I do think that those are things that can be done safely. And I imagine that those are things in very short order we're going to be able to find a way to allow to have happening at Cushing. We absolutely recognize that those are really important for the mental health of both the parents and probably especially the kids. So I think that there's ways to do that and to do it safely, but we definitely don't want to jump into doing anything like that without a lot of careful thought and the right timing, because it's not worth risking our being able to sustain our reopening.
Yeah, thank you. Question here, I think I addressed it in the presentation, but I think it's worth mentioning it again. Please help reconcile while faculty get to take visits and have visitors when the boarders can't go home or see their families. Does not seem equitable. Yeah, as a student, I would imagine that's a really tough thing to know or to see. And we do have a process for those who live on campus, and they are, as I said during the presentation, compromising. But you know, in all of our years as a boarding school community before COVID, certainly different requirements and rules for adults versus students, and also requirements and restrictions, and what we allow adults to do and require adults to do, and what we have as a set of rules and standards for students to do. And it's one of the things that I said was, you know, fair is unequal. And sometimes that is fair for an adult to have a different set of requirements as a professional, someone who's here, someone who's been involved in this, and this is their livelihood and their place of employment. And then a student coming in who does have a tendency to want to be social, doesn't have a completely developed brain, doesn't have, you know, there are just other ways that they approach this situation than adults do. And sure, you know, there may not be compliance on either end, but as we're looking at what's allowable for each group, they have to be different. They're developmentally different people. Anything to add to that from a medical perspective?
I guess I'll just add a couple things, just reading the questions, because I agree with each example. It can look unfair, but this has come up in a couple of our conversations. Just to remember that the kids in the waddles, we have to really think of them as members of a congregate setting, which is sort of the highest risk. It's sort of a big family where we know transmission is much more likely than in a classroom setting, for example. So with a lot of the questions about the day students versus the boarders, I think the boarders need to think of themselves as a big family. So I think the perspective that a lot of us are taking when we're trying to keep the campus safe is, what is the consequence? So the consequence of a day student getting COVID, you know, we're going to do contact tracing, and there are probably going to be far fewer at-risk people, you know, connected to that student than a boarder. So what we're really trying to anticipate is the downstream effect of someone getting sick and the inconvenience on all the people around them, because anyone who is a close contact of a positive case is going to have to quarantine or leave campus, actually. So what we're trying to do is protect the kids who aren't the ones getting COVID either. So in terms of like the question about taking your mask off, if your child isn't a close contact of the child who inevitably gets COVID, it's going to make your child's life a lot better. Hopefully that made sense, but I just think the risks are so much higher in a congregate setting, and that's why everything seems so much more conservative than you know, outside of a setting like that, compared to kids in public school, for example.
Well said, Dr. Mouse. I totally concur there.
And the other thing, we have less than 20 students who are day students coming and going to the campus. And so comparing that to allowing almost 200 students come and go on a weekend would raise our risk tremendously.
And the day students are in their own waddle, correct? So they're being kept, and they're not allowed in dorms. So they're being kept sort of physically separated.
Okay. There's quite a bit of stress being put on our children with mass testing, since we are 4 weeks in with no knowledge of when they may be in a position to see their families and vice versa. What is the school doing to address mental health of all parties involved? Jen, do you want to take that one to start?
Sure. So we're trying to get kids that are upset and having a really hard time with anxiety, maybe feeling alone, to number one, come see us and reach out to counseling. And we've been reaching out to a lot of kids to try to support them, to kind of help them with new strategies. So you can't count on meeting people the way you could years past. Now you kind of have to think out, meet people maybe outside your waddle, and what strategies can you utilize for that. So potentially having a friend, maybe you know, sitting outside with somebody who maybe isn't out with your waddle. They have beautiful tables outside the dining hall that we're encouraging kids to, you know, socially distance and hang out with different people. So it's really just about kind of thinking outside the box so they don't feel so isolated. And I think that some of the things that Dr. Burton is lifting, like being able to go into other rooms, I think those things are going to help. But I think it's the big ticket items that everybody wants. You want them, your kids want them, but those are the things that our team here is kind of explaining that really is, it's hard, and it might not happen now. It might happen soon. It may never happen. Nobody knows, but it's, those are the things that I think we need to support the kids in the baby steps of not just, you know, getting the big ticket items, but how do we create skills to create with what you have. How can you, when you can't have what you want, how do you manage? And that's what we're trying to, the whole campus is trying to work through.
Thank you. Dr. Muchler, question for you. After 4 weeks and testing all negative, why do kids still need to wear masks within the dorm at this point if they are all negative?
So it'd be wonderful if we could do that, and unfortunately Cushing is not a bubble. There are people who do come and go, and certainly we know that mask use is not 100%. Again, the strategies are like, and I'll take this from Dr. Hohen, but it's the Swiss cheese, right? We've all had these different strategies, and each strategy has a hole in it. But if you layer those together, hopefully you can kind of close up those holes. And so it's going to be important. The most important thing we can certainly do at this point is to wear masks. And I have countless examples of folks who kind of let their guard down thinking that everything was okay. And lo and behold, someone may have been pre-symptomatic or asymptomatic and not know it. And next thing we know is that we have a situation taking place where we have people who are now creating a situation of positivity and then having quarantine and all that. So it's very best that we not let the guard down, to not assume anything, and to make sure that we are doing the very best we can to understand and appreciate how this virus can spread. So again, wearing masks, best thing. Are they 100%? No. And would you want to take off your mask and risk it even further? I think there's too much effort that everyone has had in making this happen to risk that and to assume that everything's going to be okay. So that's the reason why we're doing that. Again, it'd be great if we were a bubble. Then we could, but we're not. And we have to kind of keep moving forward with, again, risk mitigation.
Thank you. A bunch of questions in here about winter athletics. And again, lots of uncertainty there. I know Division I hockey postponed the start of their season. The New England Pepper School Athletic Council hasn't made any official statements yet. So it's a lot of wait and see. I know somebody also added MIAA has approved, I think, contests starting, I'll go back to the question, I think in October. You know, will we do that? You know, we're proceeding cautiously. You know, we're talking with this group almost on a daily basis. I mean, there's certainly regular meetings a couple times a week, but, you know, I may pitch a question to Dr. Muchler or Dr. Bravo, or, you know, I know Elise is in contact, and so there's a lot of fluid conversation as things change day to day. You know, we don't know what the future is going to look like. I know there's some predictions that our medical team maybe can talk about the state of the pandemic and what the fall will look like, and we don't, will it be like that here in Massachusetts? Will it impact athletics? I wish I knew, but we don't. So we're proceeding cautiously in order to maintain the health of the community and preserve the in-person learning experience. Anything anybody want to add to what the fall's predicted to look like in terms of the
well, I'll just say, I know, and this group certainly knows it, but to share with the parents, you know, one of the resources that we, besides the resource of each other for Cushing, one of the resources that we look to is the Children's Hospital of Philadelphia, or CHOPS Policy Lab. And the director of that policy lab, Dr. Rubin, has had a real sort of eye towards schools, and particularly independent schools. And I believe others maybe have had the opportunity to be in regular contact with Dr. Rubin. But that CHOP Policy Lab every Wednesday puts out sort of a report. They have a wonderful dashboard. All of their information is available. You can just Google it and go see. And I really like how they sort of frame things, again, because they tend to sort of think about schools, and Dr. Rubin has been especially sort of considerate of residential schools when he's making his sort of recommendations and predictions and modeling and that sort of thing. And so that's a really good resource. And essentially, I actually just talked to him earlier today, and you know, I think we're all tending to sort of, you know, polish off our crystal balls a little bit and start to see, you know, what are some of the early predictions coming. And it does seem to be that November is going to be when we start to see some real challenges, that we may start to see cases, you know, tick upwards. Now, he does, and other public health experts are quick to note that New England has been particularly excellent and having low transmission rates. And so we hope that that stays that way. But there is a concern, you know, across significant regions and most of the country that we're going to start to see, you know, things point in a sort of more challenging direction in starting in early to mid November. And you know, some of that is just looking at the predictions of the transmission cycles for COVID, but some of that is sort of layering on top of that the flu season. And of course, you know, we would love to have a very mild flu season, and that might help us, but any flu season at all is going to be a challenge to clinicians, and it's going to be a challenge you know, to those of us that live and work in high-risk settings like a residential school. So I'm sort of fastening my seatbelt for November, and that's sort of staying challenging, you know, through to mid to late January. That would be my prediction on the advice of Dr. Rubin and the CHOP Policy Lab.
Great. Let's see, question. I appreciate the strict protocols from a perspective of a parent who lives much further away, who cannot visit due to COVID. But could not regularly visit anyways. It's a blessing to have a safe place for my daughter to have an experience she cannot garner at home, all of her sports and school in one place. I think the pros outweigh the cons experiencing restrictions. The worst thing would be for the campus to close and all students to suffer the consequences. Thank you all for the long haul. Thank you to the team for being so considerate of these factors. So thank you all. So I won't read, there's a few like that, so I won't read them all. Try to get to a question. So there's also a few questions in here about food. You know, certainly our dining hall staff is adjusting to the new normal as well, right? Every meal packaged, and you might want a piece of this meal and a piece of that meal, and how do we combine? And you know, we want the pizza oven back. And at our assembly, we had the soft serve request come from student body, and our medical team was there for that. And we're working on ways to not only enhance offerings and make them a bigger variety, but also meet those requests and bring them back. We are having ongoing conversations with our food service director. It's an important part of the experience here, and we take it seriously. All right, thank you for your information tonight and for answering these questions. It's hard to understand what the goal is. How does the dimmer switch really get to full on? COVID eradication. Is the vaccine available? What criteria needs to be met for home visits, for example? That's a long question, and I don't know who wants to start it, but I know we spoke about with the students. Maybe we'll start with the vaccine. You know, say there's a vaccine, when that happens, if that happens, timing, will it really end this? I don't know who wants to, I think we can all chime in. Anybody want to start there?
I'll just give a quick comment, but I'm sure others have information to add, so please do. But you know, there is obviously a lot of interest in a vaccine, and I think we're all sort of, you know, holding our breath for that and very anxiously awaiting that. But I think in all, you know, all sort of realistic, you know, sort of predictions and just looking at sort of what's out there, and even have opportunity in recent weeks to talk to folks at Janssen Pharmaceuticals and Johnson & Johnson and other organizations that are fast and, you know, feverishly working on vaccine development. It's very unlikely that we are going to have a widely available vaccine that's available to, you know, wide enough that anybody who wants it can get it, and that we have a vaccine that's not only widely available, but that its, you know, sort of effectiveness is wide as we would like. It's just very unlikely we're going to see that, you know, before March or April, if. And, you know, I think most people who are reasonably looking at the situation and being realistic about it are anticipating it could even be April, May, June before we see that widely available. Now, will some groups get a vaccine before that, and will trials or extend to some groups? Absolutely before that, but to be widely available in which case, you know, we can get it to everybody in the Cushing community. That's a ways away. That's the better part of the school year.
I'll certainly add too is that we don't know yet if a vaccine is developed. Will it require episodic booster shots? What's the long-term effectiveness? And, you know, are we going to be able to give it to enough people willing to take it to basically provide some herd immunity, right? Because if you have a lot of folks who don't want to do it, you're going to have only a few who've had it, and that's still going to be a problem. So even if it's available, we still have to know that masks use is going to be very important. It'd be great to certainly know with certainty what that's going to bring, but we don't know. And I think we want to be realistic and not set ourselves up for some unrealistic expectations. So it's the long haul. Vaccine preparation does take a while. It'd be great if something could be developed. It'd be record speed. We have, you know, potentially the technology, but we don't yet in terms of what that's all going to entail.
I can just speak a little bit to like the bigger question, and I'm seeing a lot of questions in the chat about just kind of like what criteria have to be reached in order for this or that restriction to be lifted, and that's something that we're actively talking about on every meeting. And I want to say that you have some great advocates at Cushing, including Dr. Burton, for the students, you know, asking the medical team every time we meet and in between meetings, when can we do that? You know, can the students really want this or that? When can we do that? And so we're, you know, they're really advocating for that, and we're having pretty deep involved conversations about it. And I think one of the reasons that it's hard to set, you know, strict criteria is because a lot of it depends on the larger context. So if Cushing is doing really well and still having negative test results and everybody's staying healthy, but, you know, cases are really blowing up in Massachusetts or in the surrounding areas, then that's a very different scenario than if you know, the Northeast stays really low incidence through the fall and winter. So in the former, you know, scenario, we'd probably have to clamp down even more and make sure that we are really on guard. But in the second scenario, you know, that might mean a gradual lifting of some of these things like you're going to experience on Monday. So it's got to be a slow ramping up, because like as Dr. Bravo said, it's really hard to go back once the cat's out of the bag.
Also, in conjunction with that and a little bit adjacent, I've seen some questions about flu vaccine. That is something that we are going to provide to students on campus this year, which I understand we historically have done. And while it does not protect against COVID, it will protect against influenza, which looks very much like COVID. So that is something we plan on offering this year to help with this entire large picture.
Great, thank you. Question said, is there a number of students choosing to leave and become remote learners? We have about 190 boarders on campus, actually almost 200 with faculty, children who live in, you know, on campus as well. And then, as I said, about 20. So we're about 220, 225 here on campus. We've had 7 boys and 5 girls choose to become remote learners, and you know, mostly for sport reasons, because we're not allowing comings and goings on weekends for you know, club sports or home visits, things like that. So we are proceeding with the rest of our community here in person, and those students get to participate in our remote learning program. I know we said we go till 8. There's a bunch of questions, so I'll just leave if our medical team has time for a couple more. I want to respect everybody's time. Questions about winter sports, which I already addressed. Question here: how are they going to get it and spread it if they do not and have not gone anywhere? They would only get it from being in contact with those who come and go from campus. I know we talked around that again, but is there anything to reinforce that? It seems like that's a consistent line of questioning.
I think that it reminds me of some of the conversations that Dr. Burton and I had when we were first talking about the planning for reopening. And I remember you said to me, you know, we've got a really good advantage here in that we're a fairly closed community, and we don't, you know, we're mostly boarding students. We don't have a lot of coming and going. And I remember thinking to myself, yeah, but everybody lives in a dorm together, and you know, that's a perfect it's a perfect scenario for really rapid spread. And so I think those are kind of two different opposing forces. And so the closed aspect of the relative, the relative seal you've got there on the community in terms of not a lot of people coming and going is acting in your favor. But if it did get onto campus, you could have rapid spread. And so the way that that's being mitigated, of course, we all know is the waddling is really important, the mask, the distancing, the hand washing, all of those strategies. But like it's been mentioned, like Dr. Munchler said, it's there are holes in all of those. They're all imperfect. They're always going to be. And so it just has to be this layered approach, and you have to do the best you can with each of them.
I think that's right. We're oftentimes talking, another analogy besides the Swiss cheese is to just recognize that there is no magic bullet that's going to sort of do this and fix it and get us back to normal, or, get us fully protected. And that what we have to do is sort of layer upon layer upon layer upon layer of risk mitigation practices. And it's true what you just said, Annie, that, it's great that we've been able to sort of affirm with our testing and such that there don't seem to be any cases on campus, right? But the minute, because we do have folks coming and going, the minute something does come to campus, we now have a pretty high risk because we're a congregate or residential living facility. And it's really important that we continue to practice those measures. So it's so different than what we're thinking about. The way we usually live our lives sort of pre-corona times is if we work really hard and do this, then that. And here it's if we work really hard and do this, we got to keep working really hard to keep doing this, and it's just not how we're used to thinking, but it's really true. Unfortunately, this wasn't, the kind of thing where if we work really hard and we get everyone here and we find out everyone's negative, we can go back to normal. We got to work really hard and get everyone here and find out everyone's negative and then stay the course so that we don't go back to the beginning of all of this or risk going back, to having to have a closure when we don't want to close. So it's a mind trick on all of us. And I think I've seen in the chat, where there is a lot of talk about just sort of the effects on the mental health. And I think that's not lost. I know we've talked about it as a team, and we've certainly talked about it with the students the other day. And I think that, absolutely we have to think, and Jen and her team over in the counseling office, such really important work that's happening to pay attention to the mental health of the students. And I think also to the mental health of the employees, right, to the entire community. So it's challenging and it's hard, but if we can stay the course and sort of be careful in that dimmer switch, we stand a much better chance of being able to be on campus and not having to all go virtual again.
Right. One question, lots of questions about athletics, and it seems like, sort of the flavor is the disappointment or of uncertainty of winter sports in comparison to, college basketball being able to start, at least as of planned today, November 25th, and, football, professional football being allowed to happen. I think it's a little bit apples to oranges. I don't know a ton about the testing protocol and the closed environments created there, but, with the tests that the NFL is doing every day, it's just not comparative to what we're doing here. Is anybody on the panel familiar with that? And certainly if testing changes, that is a game changer for us as well. But right now it's not.
I just think when you're looking at sports, you're looking at professional sports and looking at some of the large college, let's say the Power 5 football conferences, there's a lot of money going into that, and that pretty much largely entails daily testing of the group. And so that is something that doesn't trickle down to the high school levels by any means. There are certainly resource availabilities, funding, things of this nature. So it's a protocol that they're doing in these higher levels, basically to allow for us to enjoy that. But we know that, again, in Major League Baseball, and case point is that they certainly had protocols testing, and unfortunately, you still got in, and games were affected, and players were affected. So again, it's looking at the high school level where you have much less of that intensive testing. That's a problem. Again, the game changer could be, will we have the ability to do a less expensive daily test? Absolutely. I think that would be a game changer for society. And so hopefully something like that will be coming down the pike.
Great. Last one I'll answer about sports, and then we'll move on to something else and hopefully close out. Given the prediction just made about escalation of COVID and late fall, winter, seems clear playing competitive winter sports is unlikely given restrictions students are now living under with case transmission in Ashburnham below 0.003%. Is this a good assumption to work with? I don't think we can make any assumptions about the future. We don't know. There is a prediction there. College sports set dates and change dates, and with 2 months out, I think in COVID time, that's like 2 years. So given what we have to work with. So again, we're proceeding cautiously. We're in touch with heads of every boarding school in our local area, and I can tell you we're doing nothing different from those schools and looking at fall and winter sports. And as Dr. Muchler said, if you compare us to sort of like big football conferences or professional or college basketball, it's just apples to oranges and not the environment that we're living in. We're really trying to preserve an academic in-person learning community as a primary goal. All right. Well, this is a sort of overarching question and maybe a good one to, or maybe not, a good one to end with. My overarching question is, does it take a full eradication of COVID to return to normal what it once was here on campus? That's a tough one to answer too, I think, but.
That is a hard one to answer. I'll take a stab at it, and others certainly pipe in, but I do think, and I'm not quite here yet myself, but I think we have to start getting our minds wrapped around the idea that in general, things are probably not really going to ever go back to totally normal, or at least not until there's a widely available vaccine and we have good herd immunity and we have understanding about the seasonality of the transmission and the effects of the vaccine on that seasonality. And so I think that, that's a long ways off. And so things are probably not going to be back to normal anytime soon. And we have to get our minds wrapped around that. So do we need a complete eradication of coronavirus to go back to normal? Well, I would say we're probably not going to have a complete eradication of coronavirus. I think it's probably here to stay. And we're going to manage it using a vaccine and using good risk mitigation measures. And we probably, once we do have a widely available vaccine, do not need to as strictly and consistently practice these risk mitigation efforts. But I think probably for a good long time, we're going to be practicing some degree of risk mitigation efforts. So I don't think there's eradication, and I don't think there's ever a back to exactly the way things were. I think both of those things are probably semi-permanently changed.
Last one, and I'll take this one, and anybody else can feel free to chime in, and then we'll go because I know we've gone over, but I think it relates to some of the other ones. Having a dimmer switch, just clicked because somebody else did something else, sorry. Having a dimmer switch makes sense, but it still seems to be a secret as to what metrics that will actually allow that switch to move. There must be a set of specific measures, both internally and externally, that will lead to an action. You loosened some restrictions tonight, which is great, but there must have been some metrics that led to those decisions. Students and parents deserve transparency. I would say I wish we had that clear set of guidelines and linear expectations and activities that I'd put it right on the homepage that would say, if this, then that, if that, then this. And I think that really leads to the theme of this entire conversation. And I said it during the conversation, is how do we expect our entire community to adjust to an ever-changing situation where the new normal is indefinite uncertainty? Because that leads to every conversation that we have, because it changes every day. And when you're into this group of experts, and okay, it's not just about what's going on in Ashburnham, what's going on campus, what the metrics are, who's coming and going, what our risk factors are, all the planning that we've done, the enhanced cleaning, the mitigation strategies, and what other school heads are experiencing, what college and universities are experiencing. There's a lot of variables that change on a daily basis to move a dimmer switch, and to be able to write a methodology to be able to move that, I don't know, anybody here want to take a crack? I think that would be difficult.
I think if you look across the country and the world even at that, I don't think you're going to find any consistent metric system. I think it's the best looking at the most information that we have and making a judgment call upon where you live and what factors you have the ability to control versus not. So I know in the engineering world, yes, you like to have this and this will equal this, but unfortunately, when we're dealing with this situation, it's not a straight answer. It's really kind of the fact that it's more of an art than an exact science, and we have to understand there's uncertainty, and we have to understand that that is real. And so I think when you're dealing with uncertain situations, you don't want to go from point A to point B very fast. You want to proceed cautiously and kind of get a sense of that. So I think that, again, it's what's happening with the community, the state, what's happening in terms of anticipation of what the virus is doing. But that's where the data comes in, and that's what's going to guide the metrics. It's the data, and the data can change from week to week, and as we know. So great to have a firm answer. I don't have it.
Randy, can I add something?
Go ahead, Jen.
So I feel everybody's pain. I feel the pain of being a parent and just being disappointed by the answers. Cushing doesn't want your children to feel like they're in prison and doesn't want it to be uncomfortable, but it kind of is what it is. And speaking from my two kids, they have their highs and their lows. There's great moments when they come home and they're talking all about the wonderful teachers and the things that they're learning, and that they've had a great day. And then there's days when they come home and it's crappy and they want to be remote and they don't like it and they've just had a terrible day. And so as a parent and as a faculty, we're trying to support the kids through the highs and the lows. But what I keep coming back to is I'm thankful for the Cushing community, because I know there's such loving faculty that really, truly care. They show up every day. It's a struggle to do the online, the remote, to do it all. They're up in the middle of the night. They're doing temperature checks first thing in the morning when they've been up until 2 in the morning. So they're giving all that they have. And then I look at my local public school where kids are like still not even, I think they went back today. And it's, I think the first day was a half a day. And I've heard, my kids' friends saying that it's just awful. And they're not really learning anything. And so I'm thankful for that my kid is able to come at least for 13 weeks and be around other kids, even for 13 weeks. And then maybe in the winter, we're back to remote. But so I just think we have to take what we can take and kind of move from it and, have them come to counseling, have them go to the health center. The health center is awesome. It's a whole rebuilt building with COVID beds and it's awesome, the changes that the school has put in. So I just hope people won't just say, we can't come to campus to take our kid for the weekend. Just give it a chance because I do think it's still an amazing school.
Well, thanks. We'll end on that. I think communication is key, and I tried to take some of the harder questions actually from here tonight as well, just to make sure that we were getting it all out there, having the conversation, starting to be able to have that dialogue back and forth, because we're here. As Jen said, our goal is to support your students, and we want to do that. And it's among the reality of a pandemic. But certainly our goal is to continue to do so in a safe environment as possible. So thank you. Keep that communication coming. The way that we can support is if we're talking to each other and we have information that you have and that we can address it here on campus. We've said that, over the last few years, that it is a partnership. We want to continue a partnership even more so during this difficult time. So again, thank you to our medical team for not only your work since early May, but also for joining us tonight. Really appreciate the expertise that you bring. And it's gotten us to where we are. And so thank you. And thank you to our parents for having your kids here and also for taking the time to join us tonight. So thank you all.
Thanks, Randy. Thanks, Christine.
Thanks for having us, Dr. Burden.
Yes, thank you.